And can you tell me about yourself a little bit?
Yes, I'm a psychiatrist. I've been in practice for over 30 years, mainly doing psychopharmacology, treating people with medication for psychiatric illnesses. I went to Georgetown Medical School, which was a great place, and I did my residency at Columbia Presbyterian Hospital in psychiatry. And the last 6 years, I've been doing a new form of treatment called TMS, Transcranial Magnetic Stimulation. Well, we're not sure. There's a couple of different theories, but one logical reason is that the left side of the brain is hypoactive in depression. There's less electrical activity, there's less metabolism, there's less blood flow. And the standard treatment for depression is an excitatory treatment on the left side. And that does increase electrical activity and blood flow and metabolism. And that increase in activity lasts for about 45 minutes after the treatment. That may have something to do with it, but it's probably more complicated than that, because after 45 minutes, all of the activity goes back down to the baseline. A lot of doctors I know who practice it have claimed they're getting up to 80% of people all the way to normal. I think that may be true in people that have an extremely good prognosis, but when I look at the statistics with a jaundiced eye, then I get about 50% of people all the way to normal. Most of these people are treatment-resistant depressions who have been on multiple medications, and for years, maybe the medicine's working, but they've never been up to normal. And even in those people, we get about 50% of people all the way to normal. It works very well. Now, it's a little bit better prognosis if you're young, between 20 and 75, and you occasionally are in a completely normal mood, and that sometimes the medicines work and you're feeling perfect and you're just not depressed at all for long periods of time, and now you're in a depression that's lasting longer than usual. Now that would be a better prognosis. And if someone has been on antidepressants for years and the antidepressants haven't worked at all, that they've stayed severely depressed and the antidepressants have done nothing at all, then of course that would be a little worse prognosis. And then people who respond to antidepressants but lose the benefit or they only work partially, then that would be more of a in-between prognosis. Well, usually I make the decisions. The doctor who's TMS practitioner will make the decision on where the treatment's going to be, what the parameters are, how many pulses, and so on. But we have technicians who are trained to do it, and they will do it exactly the way we set it up. And then they repeat the treatment exactly every time. We have a cap, and we mark where the treatment is going to be exactly, so that we can do the same treatment again and again. And then if we're not getting the benefit we want, we might decide to change the treatment a little. Well, almost anyone who has depression that's very difficult to treat ought to get TMS. And because if you haven't responded well to antidepressants for 5 years and you've tried 10 different antidepressants, the likelihood that the next antidepressant is going to work and bring you all the way to normal is close to zero. Now, maybe you would take an MAO inhibitor, you've never had it before, it's a stronger antidepressant than others, and maybe it would work better than the previous 10. But I doubt if it would bring you all the way to normal if you've been not getting to close to normal previously. And but with this, you have a 50% chance of coming all the way to normal. And even if you don't come all the way to normal, if you just improve by 50% or 75%, that's pretty good. No, this is a very mild treatment. All we're doing is putting a magnetic field on and off in a brief pulse, and it just goes 2 to 3 centimeters into the brain. And if we use the BrainsWay machine, which is deep TMS, it goes 6 or 7 centimeters in. And it's just there for a fraction of a second, and it either excites that area just a little bit or it calms the area down. rTMS is repetitive TMS. So actually all TMS that we use for treatment would technically be rTMS, repetitive transcranial magnetic stimulation. And if you have a researcher who's doing research on the brain and on neurological problems and so on, he or she might just use 1 or 2 pulses and then measure various things having to do with those pulses. And that would also be called TMS, but it's just single or 2 or 3 pulses. It's not really repetitive TMS. So any TMS that's used for treatment is repetitive TMS.
Okay.
But for short, we usually just call it TMS. Regular TMS is performed with a double coil, two coils of copper that come together, and when the electricity runs through the copper coils, it creates a magnet, and the magnet will be strongest where the 2 coils meet, and that spot is put either on the left dorsolateral prefrontal cortex or on the right, and the effect it has is in an area maybe the size of a silver dollar, and just goes in 2 or 3 centimeters. The BrainsWay deep TMS is very different. A physicist named Yitzhak Roth in Jerusalem at the BrainsWay company developed copper coils in a configuration, they're called H coils, that causes the magnetic field to go much deeper, like perhaps 6 or 7 centimeters into the brain, and then it ends up covering a bigger portion of the brain. It goes a little bit over to the right side, and it goes deeper. So it's in the same general area, but in a way, the treatments are fairly different. And if somebody fails on one, or they're not doing well on one, it's nice to have the other machine, because then we just switch them to the other machine and do that. The only people that really cannot have it is someone who's had brain surgery and they've left some ferromagnetic metal in there, some iron that is magnetic, and then the TMS could heat that up, and that could be a problem. However, I have a friend that I would like to do some TMS on because of a semi-paralysis she has, and the clip she has on the baryaneurysm that she had is a stainless steel clip. And stainless steel has iron in it, but it's almost not magnetic at all. Plus, it's on the opposite side of the brain of where the treatment would be, and the treatment in her case would be an inhibitory treatment, 1 pulse per second, so that wouldn't heat up the area anyway. So there are exceptions. Now the other types of patients one would have to be very careful of is somebody who has a seizure disorder. If somebody has a seizure disorder, about 1 out of 200 of them will have a seizure induced by the TMS. So it's not contraindicated, but it's a relative contraindication. You'd want to be careful and either take our chances, or based on if we think the outcome is well worth the risk, or possibly increase the anti-seizure medicine that she or he is taking. TMS is covered more and more by insurance, and it's been FDA approved now since 2008. So it's harder and harder for the companies to deny coverage, but they try very hard to deny coverage. It's also harder and harder for them to deny it when they've seen so many people get better and sometimes have the whole course of their illness changed, so that now their depressions are much easier to treat. Medicare is a federal insurance for people over 65. And it came out under Lyndon Johnson. And now it pays for TMS. So there are many TMS practitioners who are in the Medicare system. So then you can have it done for a very low cost. If you have to pay a co-payment, then it would come to about $1,500 for 30 treatments. That's what a lot of people are afraid of, and they have this fear, that you're doing something sort of electrical to the brain, like ECT. The only thing that they have in common is they are both a stimulating treatment to the brain. They both have a sort of electrical stimulation to the brain. But they're completely different. With ECT, you run a huge amount of electricity through the skull. And the electricity doesn't want to go through the skull. It wants to go around. A lot of it tends to go around the surface. It doesn't want to penetrate the skull. So you have to use a very large amount, and you use enough to induce a grand mal seizure. So the person has an epileptic seizure. Nowadays, we paralyze the person and we put them to sleep before it happens, and so you don't see the seizure very much. It's just a very small movement. We do that for safety, and also so that for their comfort. And that somehow seems to reboot the brain. And usually you do 10 treatments of that, and often it works quite well. The TMS is completely different because you're just using a magnetic field that goes a few centimeters into the brain, and the skull does not block the magnetic field. That's one of the beauties of it. So you can stimulate the brain, either make the neurons discharge more easily or inhibit them a little, depending on how you do it. And you have to use very little energy to do this. And the person stays awake. They don't have any anesthesia. It's usually quite comfortable. In fact, some people tend to fall asleep during the treatment. And then after the treatment, they go off to school or go off to their job. It very rarely interferes with your life, except for taking up some time. Usually we think of the typical course as being 30 treatments, and we try to do 5 treatments a week for 6 weeks for 30 treatments. And that seems to be about equal to 10 ECT treatments, which are done usually Monday, Wednesday, and Friday until you reach 10. A big difference is that with ECT, frequently people relapse 6 or 12 months later, and then they have to have the 10 ECT treatments all over again. With TMS, it's interesting that very often people will go much longer before they relapse, although hopefully they're on some prophylactic antidepressant after the TMS to help keep them from relapsing. And when they do relapse, they almost never need a full 30 treatments again. Often they just need 5 or 6 treatments, and we have quite a few people that they relapse every 3 months or 6 months or every 9 to 12 months or something, and they come in and they get 1 treatment or 2 treatments and they're back up to normal. So when you relapse with TMS, you don't need so many treatments again. And Harold Sackheim, who was the head of ECT research at Columbia for 20 years, he said that he thinks that what is happening with TMS is that the brain is curing itself. That with this small intervention, we are somehow enabling the brain to cure itself of the depression. And this would make sense for why we have had people have such long periods of feeling normal after TMS. We have people that have gone over 3 years without a relapse when they had never been normal before. It makes sense that the brain wanted to get better and got itself better and then has stayed better. Well, the main risk is that you would induce a grand mal seizure, and that happens in about 1 out of 10,000 treatments, but more like 1 out of 200 if you have a seizure disorder. We haven't had anybody have a seizure, and we try to be very careful about that, where you place it and not have the intensity too high, and so on. However, when people have had a seizure, nothing terrible has happened because they're sitting in the chair. They're not driving a car. It's happening while they got the treatment. So they're not falling down and hitting their head or driving off the road or something like that. The main side effect is the first 2 or 3 treatments you might get a headache and feel headachy. And that's because the copper coil and the magnet is right against the scalp muscles. And so the scalp muscles can tense up, and then you feel a little discomfort and have a headache. But usually after 2 or 3 treatments, the scalp muscles get accommodated and you don't have a problem. Now, we have had 3 people out of a few hundred who got tired because of the TMS. One just had a minor problem with it, but 2 people, one was 18 and the other was 83, would become extremely fatigued that would last a day or 2. And with the 18-year-old, it made him really dislike the procedure a lot. Although, when he had a little relapse a year later and again 2 years later, he did come in and got some touch-up treatments to bring him up to normal. And with the older gentleman, at first we just thought it was him being tired because we were doing him twice a day because he came from a long ways away, so we would do 2 treatments a day, a few hours apart, so he had to come and go a lot. But it was actually the treatment itself was making him feel tired. No, does not cause memory loss. In fact, it seems very difficult to cause a problem with TMS. That if you put the TMS machine in the wrong place and you do the wrong type of pulses, it doesn't seem to make them worse. It just doesn't help. The only way you could make people worse, it seems, or at least the main way you could, is if somebody is bipolar and you do excitatory treatment on the left, that could overactivate people and make them cycle a little bit and come up into a high or an agitated state or a mixed state, and then they might come down again into a depression. So we try to avoid that, and I've just finished a paper we're trying to publish on treating people successfully, but using a low intensity inhibitory treatment on the right if they're bipolar. And we've had excellent response with them having remission from their depression without making things worse.
So no memory loss at all.
No memory loss. The TMS can be uncomfortable. If you're going to turn it up high enough, it's going to be uncomfortable because of tightening up these muscles. But we start out extremely low, and then we go up slowly every 10 or 15 seconds. And if it reaches a point where it's a little uncomfortable, the person says it's uncomfortable. And then we cut it back. And that way, if we're not up to the intensity we wish it to be, or we think it should be for maximum benefit, we may be able to do that in a few days or a week or two by gradually increasing it, and then the muscles of the scalp just accommodate and don't react so much. Now, a few times we've had people that even at relatively low intensity, they would get a lot of discomfort with the BrainsWave machine or with a left excitatory treatment with our MagPro machine. And then we simply had to switch them to another machine, or we had to switch the treatment to doing a quiet inhibitory treatment on the right. Yes, in fact, you should take antidepressants while you're receiving TMS. You should be taking something that's been working. You should probably stay on it. Now, of course, if somebody's very bipolar or more bipolar than anybody's realized, it would be better not to be on much of the standard antidepressants and it would be better to be on mood stabilizers that have an antidepressant effect, such as fish oil and lamotrigine, which is called Lamictal, and Depakote, which is divalproate, or small doses of lithium, or carbamazepine. There's quite a few other medicines that we call mood stabilizers, which are actually antidepressants. It's just that they don't make bipolar disorder worse. You know, I have almost nobody who has stopped the medication completely. But I've heard of people who have. And I think that one can stop medicines if you use the TMS, but you're almost certainly going to have maintenance treatment. So you might have to have 2 TMS treatments once a month or 1 TMS treatment per week. I'm not sure how often it would end up in that, and I'm sure it's very variable from person to person. But it's usually a good idea to stay on something. And and a lot of times people do end up on a lot less medicine. One person I had who was having severely agitated depressions with massive anxiety and panic attacks and was on a lot of either Depakote, divalproate, or Tegretol, carbamazepine, and a little bit of lithium, and Lamictal, lamotrigine, and maybe a couple of other things. She ended up on about half as much medicine after the TMS, and then 2 years later she ended up on just lamotrigine. So she only is taking one medicine, maybe a tiny amount of a benzodiazepine or a little thyroid, I forget what else, but basically just one medicine in a relatively low dose, and she's now gone 4 years and 6 months without a relapse at all, and is in her 4th year of college now and is planning to go to medical school next year. And when we started the treatment at 21, she had said to me, "Dr. McMullen, how am I ever going to get a husband, or how am I going to get a career, because I haven't finished a single college course?" Because she just couldn't think clearly she was so depressed and she had such massive anxiety it was hard to leave the apartment to get on the subways. And so she started a lot of college courses but never finished any. And then after the TMS, she's been able to go to school full time. Yeah, the FDA approved TMS for depression in 2008.
Wow.
Now we use TMS for other things sometimes. We use it for obsessive compulsive disorder and Parkinson's disease and some movement disorders.
Sure.
It sometimes helps with migraines. There's a number of things it helps with, but those are all off-label. The only thing it's officially approved for is depression.
Thank you very much, Doctor.